Today we are going to start a new chapter, that is a treat for mosquitoes. Here we will identify the malaria causing mosquito, discuss the preventive measures of malaria, explain anemia, and discuss diseases caused by flies. Blood test. Rajat is back at school today. He had been absent for many days. How are you now? Asked Aarti. I'm all right, Rajat replied softly. Just Kirat. You must have played a lot while you were at home. Rajat. Who wants to play when you have fever? On top of it, I had to take a bitter medicine. I even had a blood test. Just Kirat. A blood test? Why? It must have been very painful. Jaskirat. Actually, when the needle pricked my finger, it felt like an ant bite. They took 2 to 3 drops of blood and sent it for testing. That's how we came to know that I had malaria. Nancy. But you get malaria when a mosquito bites you. Rajat. Yes. But we find out by the blood test. Jaskirat. There are a lot of mosquitoes in my house these days. But I did not get malaria. Nancy. Who says that every mosquito bite causes malaria? Malaria spreads only by the disease-causing mosquitoes. Aarti. All mosquitoes look the same to me. Rajat. There must be some difference. Here in this picture you can see how the blood is taking the blood on the glass side for test, and malaria is caused by the female Anopheles mosquitoes. Okay, malaria spreads through female mosquitoes, Anopheles, female Anopheles mosquitoes. Now this is the picture of a microscope. Here the doctor is seeing through the microscope. Dr. Miriam looking at the blood slide under the microscope. This microscope makes things look 1,000 times bigger. The details inside the blood can be seen clearly. There are some microscopes which makes things look even more bigger than this one. Let me show you another microscope clearly. This is another microscope here. So here we came to know that malaria is spread only by the disease causing mosquitoes. And what is the disease causing mosquito? It is female Anopheles mosquito. Nancy, did they take the blood from the place where mosquito had bitten you? Rajat, of course not. How do I know when and where the mosquito bit me? It can't be known where the mosquito bite you. Okay. Now, Nancy, but how could they find out that you had malaria by your blood test? Do you think they could see something in the blood? Here it is discussed through the microscope. The blood slide is seen, and through that the doctors can find out whether you are having malaria or not. Now let us discuss some questions. Do you know anyone who had malaria? Yes, there are so many people whom you know, out of whom some have got malaria. How did they find out that they had malaria? They found out by blood test. It is obvious blood test is to be done. Then what problems did they have on having malaria? For that I want to show you one clinical pathological report or clinical pathology report. Let us see here. It is on page 69. Clinical pathology report. It was issued to Rajat. You can see here name clearly Rajat. Age is given 11 and male. What diagnosis was done? Fever with chills and rigors. Fever with chills and rigors. ठंड लगकर कपकपी के साथ बुखार. Then malaria, finally it is given malaria parasite found in blood sample. So what problems did they have on having malaria? So there will be fever with chills and rigors. That means you will shiver. You will shiver when you will have malaria. You will have fever due to malaria. And you will feel very weak. What other diseases can be caused by mosquito bites? So it will be dengue, chikungunya and filaria. In which season is malaria more common? Why do you think this happens? It is more common in rainy season because mosquitoes get suitable environment to breed during this season. They breed in this rainy season, and as a result more mosquitoes are grown. Okay, so malaria is caused during rainy season. Next question, what do you do in your house to protect yourself from mosquitoes? Also find out from your friends about what they do. So first and foremost thing what we do, that we use mosquito repellents. They come in coils, liquids and mats. Then we use mosquito repellent cream, mosquito nets, wire mesh on windows so that mosquito can't enter in our house. Keeping the surroundings clean and removing stagnant water from the surroundings. You can see here this is a mosquito net. These are coils. These are coil and repellent. These are mosquito repellents, and this is mosquito repellent cream. Some are using spray, making smokes. Look at the report on the blood test given here. So this I have already discussed. Which words in the report help us to know that the person has malaria? From this line, malaria parasite found in blood sample. From this line, we can understand that a person is having malaria. Malaria parasite found in blood sample. Medicine for malaria. From early times, the dried and powdered bark of cinchona tree was used to make medicine for malaria. Earlier, people used to boil the bark powder and strain the water which was given to patients. Now tablets are made from this. Now we will discuss anemia. What's that? Aarti. You know, I also had to get a blood test done, but they took a syringe full of blood. The blood test showed that I had anemia. Rajat, what is that? Aarti, the doctor said that there is less hemoglobin or iron in the blood. Now what is hemoglobin? It is a red color pigment present in RBC. RBC means red blood cells of our blood, and it binds with oxygen and transport oxygen to different parts of our body. Okay. The doctor gave some medicines to give me strength. He also said that I should eat jaggery. Jaggery means gur, amla, and more green leafy vegetables because these have iron. So we get iron or iron from these jaggery, amla, and more green leafy vegetables. We should eat all these to avoid anemia. Nancy, how can there be iron in our blood? Jaskirat, there are something about this in the newspaper yesterday. Rajat, laughing. So, then you ate iron or what? Aarti, silly. This is not the iron used to make these keys. I don't know exactly what it was. After I ate a lot of vegetables and whatever the doctor had said, my hemoglobin went up. So, if you follow the doctor's instructions and eat jaggery, amla, and green leafy vegetables, your hemoglobin will be in perfect condition. So let us see what is written in the newspaper. Anemia common in Delhi school. 17 November 2007. It was in 17 November 2007. Thousands of children studying in the municipal corporation schools in Delhi suffer from anemia. This is affecting both their physical and as well as mental health. Due to anemia, children do not grow well and their energy levels are low. This also affects their ability to study properly. Now, health checkups are being done in the schools and health cards are being made for all the children. Anemic children are also being given iron tablets. So here are the reports, of Aarti. Here are two reports. It was done in the month of June and it is done in the month of September. So what are the difference? Here you can see she was having 8 gm per dl hemoglobin and here it is 10.5 gm per dl. So it increased after 3 months, about 3 months, the hemoglobin increased. So look at Aarti's blood report and find out the minimum required hemoglobin. So the minimum required hemoglobin here you can get. So minimum is 12 gm per dl. How much did Aarti's hemoglobin go up and how long did it take for that? It is almost 3 months and it increased by 30%. What does the newspaper report say about the problems caused by anemia? So here it is given clearly. Due to anemia, both the physical and the mental health are affected of the children and they don't grow well and their energy levels are also low. And this also affect their ability to study properly. So next, have you had a health checkup in your school? Yes, you must have done this. What did the doctor tell you? That you are fit and healthy. Find out. Ask a doctor or elders about the food items which contain iron. Already I have discussed that green leafy vegetables, amla, jaggery, and also spinach, lettuce. All this increase your hemoglobin. You should eat them for iron.